Welcome to the February Board of Health meeting. I'd like to acknowledge that Bob Harrison is here representing the commission. And Bob, we welcome you. We're so glad to have your expertise on the board. Thank you so much for joining us.
Well, thank you. I'm looking forward to it.
All right, good. You have in front of you the Board of Health minutes from our January meeting. May I have a motion for approval?
So moved.
I'll move.
Okay, so Vanessa moved and second, please.
Second, Joe.
Okay, so it's Joe second. All right, any discussion? All those in favor?
Aye.
Okay, opposed? Okay, motion carried. Thank you again, Kim, for your good work. We really appreciate it, for your preciseness on the minutes. So thank you. We have vouchers that were passed out by Lisa. Lisa, do you have any comments on the vouchers that are submitted?
Everything looked pretty normal. There was one item over 5,000. It was $5,001 for our MALF dues payment for the year. So that was pretty much the only item of any significance that I noticed.
All right. May I have a motion for approval of the vouchers, please?
So moved, Ray?
Okay, Ray has moved. May I have a second, please?
Linda,
Linda has second. Any discussion about the vouchers? All in favor?
Aye.
Aye.
Opposed? Okay, motion carried. Thanks so much. I really like the little boxes, Lisa. That's really, I don't know how you do that, but that's very helpful to kind of highlight the ones that need some attention. Thank you so much. All right, we have 3 resolutions in front of us.
Yes, so this first one, and Lisa helped chime in to make sure we get it all straight, but this first one, number 153, is an amendment to our comprehensive agreement. So this is the second amendment for fiscal year 2021. And there's some additional money that is in there. So we've got additional expenditures to cover COVID-19 vaccination activities. That's in the amount of $133,000. There's some additional funding that we had known about and had talked about in, I think, November it was, for some additional funding for the Benton Harbor water filter lead response program. And that's to the tune of $65,000 for staffing. There's also some money carrying forward from COVID from last year, and it's moving it into this year's contract. And we have some other grant programs that have received additional funding, like Taking Pride in Prevention, which is a pregnancy prevention program. There was an additional $10,000 there. There's a new award of $36,000. That's part of the Michigan Home Visiting Initiative. This funding, I believe, has been in our community before, but with a different organization. And there was an increase in the WIC breastfeeding program. Now, there's also some catch up from contracts of things we already knew that were happening, but it's just making it into the contract now. That's a decrease in our MyApp program. As we know, there was a fairly significant decrease of about $155,000 to that program. We've already made all of the adjustments to staffing levels and the budget in that program. It's just finally coming through the contract right now. So Lisa, are there any details in there that you'd like to cover that I missed?
No, that this is our, Nikki, as you said, our second amendment. So it's kind of the standard cycle. The total of all those adjustments, which I should have included in the resolution, was an additional 258,000. There will be additional funding that's already being sort of discussed at the state level for our vaccination effort. So we're seeing some of that work through the contract. It takes a while for things to kind of bounce back and forth between us and the state to get it to actually flow through to the contract. So everything looks pretty normal there. If anyone has any questions.
Right, hearing no questions, I propose to take all three resolutions together unless there's particular discussion about one. So if we can move to the next resolution, that would be good.
Yep, so the next resolution is number 154, and this is to accept funding from LARA, the Department of Licensing and Regulatory Affairs at the state. And this is the third or fourth year that we've had this, but this is accepting funding for a medical marijuana education program campaign. We brought a resolution to you in December, I believe, to apply for this funding. We've now been awarded it, and this is accepting it. It's in the amount of $48,220. In previous years, we have worked with a media company to help develop some messaging campaigns. This is where our Dirt on Weed campaign comes from as well.
All right, any questions? So
Yeah,
Bob, you're taking, yes, Dwayne.
Well, can you just hit what the core elements are, what we communicate, what we educate about?
Jillian, could you cover those key points?
Yes, absolutely. So the Dirt on Weed campaign has been 2 years now, and we're exploring putting that back out in the community for a third year. There are a few elements that it focuses on, including youth prevention component, making sure that folks understand who is of legal age to partake in marijuana use, and making sure that it's explained youth are not allowed to, and the negative health consequences for the developing brain. Additionally, there is a focus on making sure that pregnant and breastfeeding women understand how marijuana could impact their pregnancy and their breastfeeding journey. And then lastly, there is just for adults, legal users, an emphasis on safe storage and handling to make sure that any marijuana products are kept and stored safely and not falling into the wrong hands.
No, that sounds good. There's an article that just came out very recently on, and smoking marijuana almost guarantees you lose a few points in your IQ. So we could promote that. If you feel too intelligent, smoke marijuana.
Don't know anybody like that.
All right. So, Bob, we know that you're representing us at the Board of Commissions. So, you know, if you have any questions or anything,
Sure.
we're glad to follow up later after the meeting with you, the staff.
Okay, thank you.
So, yep.
Thank you.
All right. The next resolution, please.
Yep, the next resolution, number 152 on the agenda, is actually a contract with Fair Food Network for the Double Up Food Bucks program, which is a hallmark of the Benton Harbor Farmers Market. And the health department does serve as the fiduciary for that program. Just as a reminder, Double Up Food Bucks provides matching funds for people who use their bridge cards at a farmer's market on Michigan grown produce. So if somebody comes to the market, wants to spend $10 with a bridge card, they're given an additional $10, so it doubles their spending power to increase access to fresh food. We have been awarded $2,500 for this year to be able to use as part of that matching program. And the Fair Food Network is generally pretty amenable to adjusting that amount if it seems like that is warranted throughout the year. So if we look like we're on course to go through that before the market season ends, there's often an amendment to increase that amount. But it's not farmers market season, but they've also moved towards, at least for us, but we've moved towards this being just an annual January 1 to December 31st program. So that's why we're bringing the contract to you today.
That's great. It's really important. I wish we had a winter market in Berrien County somewhere. That would be really nice.
Yeah.
All right, Linda, yes?
Excuse me, and we used all the 2,500 Double Up Food Bucks last year?
Last year we, go ahead, Nikki.
No, I know we had less than 2,500.
Yeah,
So whatever we got, sorry.
we had a really good market over the summer, so they've actually bumped our amount up a little bit this year. So we're looking good. The market seems to get stronger each year that we have it. So it's been a really positive experience.
All right, you have 3 resolutions in front of you. May I have a motion for approval?
So
And
moved,
a
Dwayne.
motion to accept them all?
So, so Dwayne is moved. Would you second, Ken?
That'd be great.
Okay, so Dwayne moved, Ken second to accept all 3 resolutions. All those in favor, say aye.
Aye.
Opposed? None, so resolutions carried. Thank you so much. All right, moving on to the financial report. Lisa? Oops, you're on mute.
Good morning. So in your packets, you have financial statements through December. These are preliminary, so we have yet to go through the whole audit process. We ended the year very strongly. COVID, of course, having a big effect on the financials. State and federal grant revenues through December are 690,000 over budget, which is about 18%, and 603,000 favorable to last year. So again, COVID showing a large financial impact. COVID-related revenues were so far through December 764,000. We are looking at awards for 2021 already in the realm of 1.2 million. So we'll carry on our efforts there. On other revenue items, permits and inspections were favorable to budget, 62,000, and over last year by 33,000. Food service licenses were actually ended the year slightly better than I expected at 197,000 versus a budget of 195, so just a little bit over budget. Where we really exceeded were permitting revenues. So for septic, septage, and well permits, they totaled almost 200,000, and we're over budget by about 59,000 and over last year by 50,000. So healthy increase there. Our Medicaid, Medicare, private insurance amounts, basically clinic revenues were under budget. Again, having a COVID impact, clinic closures or slowdowns in some of our programs. But we were also under last year by about 38,000. Our in-kind revenues, I have to tell you that I made a mistake on vaccinations, federal in-kind. Somehow I replaced the budget where it says 160,000. That should actually be 134,727. My apologies on that line item. Other sources and grant revenues, we have deferred some of our United Way funding because we're devoting effort towards COVID. We have underspent the United Way funds our Nurse Family Partnership Program and Positive Parenting programs, our Triple P program. So those amounts are deferred and will cover expenses into 2021. On the expenditure side, we still even ended the year for salaries and benefits under budget by 200,000. Partly, some of that is reflective of us sharing some of our health department expenditures and transferring them to the county side. The county received revenues or an award for CARES Act funding that we were able to transfer some of our costs over to that funding. So it's a little bit messy, but our statements then reduced our salaries and benefit expenditures by those transferred costs. Other items, which I think I've addressed in prior months, our supplies are under budget, slightly over last year after I adjust out last year's water filters, so right in line with expectations. Contract services is over budget, 64,707. Part of that is a $35,000 contract that wasn't in the budget for King Media, which relates back to the marijuana program that we were discussing earlier. It was a joint advertising contract with Cass and Van Buren. We were also over another unbudgeted item for $20,000 for Area Agency on Aging medical management grant. Travel ended the year under budget, almost 51,000 COVID related. And there was also COVID related spending on the postage line and equipment purchases. That was about 85,000 combined. So we ended the year in really good shape. We had a surplus revenue over expenses of almost 209,000, which was much better than what we had budgeted for. So we're heading into 2021 with a healthy fund balance, which you'll see on the fund balance statements. We will carry in a balance in our fund balance of about 1.7 million. Any questions on the financials?
Joe, did you have a question?
I don't.
Okay.
Other than, I guess I would think of one. I would say we have plenty of resources to handle all the COVID issues. There's no cash flow shortfall or any concern doing what you need to be doing for our county.
No concerns at all. And although the money kind of trickles down to us in sort of little chunks, we're doing well. I think we will. We've increased our FTEs, and it looks like we have plenty of funds to carry on the programs and the volume of activity we're doing well into the fall.
So I'd like to just add a caveat to that. We have plenty of financial resources for the current resources we have and the current trajectory that we're on. There is definitely more that we could be doing, as we'll talk about this in a little bit with our vaccination update. I mean, we're utilizing and stretching all of our staff, and I don't know where we would be if we didn't have the additional staff that were added in the fall. But we're resourced for the human resources we have right now, but it's still a very, very heavy lift for what we're doing. And having additional resources for enhanced communications and additional help would always be helpful. So just to add that little caveat.
I have a question about the maternal child programs. We didn't spend all of that money. And as Lisa said, we were going to put that money forward to next year. Is that gonna be okay? They won't, they won't ever take the money back. We can spend it whenever we have the time and resources and to get back to sort of like a normal place with that.
Good question, Vanessa. So we work really closely with United Way, and they're definitely aware that this has been kind of a unique year. So they are allowing us and encouraging us to carry those funds forward. There no issues there.
Okay, thank you.
Would you unmute, Ray?
Lisa's follow up on that. Are we getting that kind of cooperation from other programs also?
Ray, it really depends on the program. So some of our especially our state and federal funding, there was an expectation that those grants would carry forward. So at the end of the grant years, most of our grant years end at the end of September. We they recognized that there was some funding that needed to carry forward, and those amounts are slowly but surely feeding into this year's contract. So the federal and state funding has been a little wobbly as the feds change some of the legislation around CARES Act, that sort of trickles down into and impacts our funding. But for the most part, every funder that we've worked with has been really super cooperative. So other than the reporting aspects of some of these, which can be a little challenging, we're managing really well.
Good, thank you. Thanks, Peg.
All right, yes, Linda.
It's my understanding that the Families First and CARES Act money goes through the end of September. Does that, it certainly does for us. Does that apply to you all?
Some of our funding was supposedly ended at the end of December, and then recently the state said, "Oh, we're extending it out till the middle of February." What my approach has been, what we've tried to do is make sure that we're expending and reporting against funding that's expiring the soonest. So there's kind of a trickle down effect that happens. Some of our funding, it goes all the way out till next September, and more funding is still coming down to us. So each one comes with a little bit different restriction. I'm hoping the feds give us some more as some of the new legislation comes through with the new administration. I think that'll have an impact on some of our resources.
All right. Thank you as usual for the excellent budget discussion. I appreciate that. All right, moving into administrative reports.
Yep, so I'm going to share my screen so that you all see the data presentation. All right. Okay. So just to kind of go through some of the numbers, this is the epi curve for the entire pandemic. You can see that we're really dropping down. We're actually below 40. We're starting to get into the high 30s for the number of new cases per day on average. Continues to be incredibly encouraging. We're really glad to see the direction that these numbers are moving. And all of that is happening in an environment where we're still having lots of COVID testing happening. So these are our daily tests here in Berrien County over the last 6 months. There's been some ebbs and there's some flows and some dips and everything. So we're not quite as high as we were at peak demand just before Thanksgiving, but there's still several hundred tests happening every single day in Berrien County. And so that's continuing to give us assurance that we're capturing a really good portion of the number of cases. And we can see that evidenced even more so by our percent positivity. So we're actually below 7% now for percent positivity, dramatically different from 2 months ago when we were above 20%. So all of the data is really moving in the right direction. We're seeing a lot of these declines. And perhaps one of the most encouraging places we're seeing the declines is in the hospital census. So this is the number of people on average, or 7-day rolling average of how many people are in the hospital with a confirmed COVID diagnosis or test. At the peak, this was really starting to stretch our healthcare system's capacity when we were in mid 70s, an average number of people per day in the hospital. It came down, sort of plateaued in the 50s, and now we're seeing this decline. This is, again, really encouraging. This is something that is a little bit less susceptible to change due to a testing strategy. There are some outpatient therapies that have been introduced in the last couple of months at Spectrum Health Lakeland as well, including monoclonal antibodies. So people that are at risk of potentially needing hospitalization based on what we know of the course of illness can, as an outpatient, receive monoclonal antibody treatment There's some other things that are in place to try to divert people from being inpatients if they don't need it, or if it's anticipated the disease might go that direction. But also we're seeing less transmission in the community. And as we see less transmission, we also have just fewer numbers of people that become seriously ill. So all of this data is looking really encouraging. We're seeing it reflected in the death data as well. And so we've had relatively few deaths over the last few weeks. We're definitely coming down off of this high level of deaths. So definitely still out there. We're still paying attention to transmission. The preventive measures still remain really, really important. The vaccine strategy, as I've been saying, that's our longer term investment. It will start paying dividends in the months ahead. Right now, the things we're doing to continue to control the spread and keep transmission levels low, like social distancing, wearing the mask, washing hands, avoiding large groups of people, minimizing close contact with others, those are still the things that can have a more immediate effect right now. And it does appear that we're on the downward slide. We want people to continue to be diligent with these things so that we don't have another potentially sharp uptick. But overall, the data is looking really encouraging right now. To shift gears a little bit, we're going to talk a lot more about our vaccine strategy here in a moment, but I did just want to give you a little bit of data on that. And just as a reminder, we have three main, well, and honestly, maybe this isn't a reminder to the Board of Health because a lot has changed in the month since we all last met. But we do have three vaccination goals. These goals are likely to shift a little bit over time, but where we're focused right now with vaccination is we want to prevent our health system from being overwhelmed by COVID-19 patient care. We want the health system to be able to provide the health care for all of the needs we have in our community, COVID and non-COVID. We also want to protect our most vulnerable from death and severe morbidity. We want to reduce those hospitalizations. We want to reduce the deaths. We want to reduce any of that severe illness. And we also want to maintain certain essential infrastructure. And that word certain is in there because there's only certain groups of people that are eligible for vaccination right now. It is not every essential worker as defined by CISA when we were having the stay-at-home order and trying to define that. There's certain groups that are currently eligible. But when we look at who is currently eligible, it's approximately 40,000 people in Berrien County. And first and second doses included, there's only been about 14,000 doses of vaccine distributed to Berrien County between the health system and us. We approximate that there's probably close to 8,000 healthcare providers alone in Berrien County. So this continues to be a thing where there are a lot of people that are eligible. There's a lot of people that vaccinating them definitely works in support of our goals, but we need to proceed a little bit more. We can't do everybody first. So these are, to just give you a bit of an idea, we have administered a little over 6,100 as the health department doses of vaccine. The hospital is a little bit further ahead of us just because they had so many healthcare workers to get started, but they're around 7,000, I believe, doses or vaccines administered. And then as the health department, 4,400 of those 6,000 doses have gone to older adults, 65 plus. And it's important that we're tracking that distribution of how we're hitting older adults versus essential workers because vaccine allocations are dependent a little bit on the population size of our 65 plus and our essential workers. So 75% of our allocation is made up by the older adult population, and then 25% is our essential workers. There's a little bit of that mix that they're expecting us to somewhat on the whole have that 75-25 mix. We're definitely right in the ballpark of where we should be in terms of targeting older adults as well. So the graph below is not super elegant and it does not tell the whole story. And in fact, it starts in mid-January when there's actually 3 weeks of vaccinations beforehand. So apologize for giving you just a little bit of a partial picture here. but just showing the number of vaccines that have been done on any given day by the health department. And so you can see, as we'll talk about in a minute, there's a little bit of a mix of having some really large scale clinics in high numbers, and then also having some lower numbers. And just to say it out loud, because we have gotten this question, we are not giving vaccines 7 days a week, that there's not enough vaccine allocation to really even supply clinics of any meaningful size. And we're finding we're working through a pretty good portfolio of what that looks like. And then just as a reminder that there is some information, you can't necessarily get it by provider, but you can get it by county on the Michigan COVID vaccine website. There is a dashboard there. There's lots of great data. You can see that there have been over 14,000 doses of vaccine administered. That includes first and second doses. So because we're now definitely getting heavy into second doses. So I'm going to stop there. We have a lot more information for vaccination. Is there anything just with the data specific question before we move into the other pieces?
Yes.
Nikki,
Okay, so I see Ray, Joe, and there was one other person. So Bob. So Ray, Joe, and Bob. Okay.
Vanessa.
Nikki,
Ray?
real quick, how are the, I don't know what you would call them, pharmacies doing as far as the numbers for vaccinations? I was at Myers yesterday, and it looked like they had, in Benton Harbor, looked like they had a pretty good setup and quite a few people coming in for that.
Yeah, if you don't mind, I'll save that for, we have another vaccine report I'll get to in just a minute.
Okay.
So I will
Thank
cover
you.
that there. Yep.
Okay, Joe?
Okay, and down here in Florida, it's not as smooth as it is in Michigan. But one of the things that people have raised concerns about, including media, is the difficulty of older population and minorities in enrolling. They make it, you almost have to have a PhD in computer technology to sign up. They made it, and there seems to be a disparity. Some of the very elderly that aren't computer literate enrolling and going through all the machinations and notifications and so forth. Is that true here in
Yes,
Michigan?
it's absolutely things that need to be considered, and we'll get into this a little bit more too, but you have one process that kind of automates everything and makes it real easy to do something of this scale, but that makes it easy for us, not for the public. So we've got one process that is a little bit more streamlined that more people are able to access, but there's still a significant amount of effort for that proportion of people for who that mainstream process just doesn't work. So signing up online and receiving emails does not work for a lot of the population, especially that we're targeting right now. So we do have some effort, and we'll be talking about that in a minute too. Maybe it would be helpful to just go through and talk through the rest of our update and then see what
Okay.
questions remain.
Mm-hmm.
All right.
I just have one quick question. I'm sorry, I didn't catch what the 75-25 mix was. I'm sorry.
Yeah, that's okay. So the allocations that are coming to different counties and health departments from the state, the amount of vaccine that we're all determined to get, there's a lot of things that go into that, but part of what goes into it is population size. But it's not population of the county, it's population of the people that are eligible for vaccination. So when they're determining that, 75% of it is weighted towards the older adult population, and 25% of it is weighted towards the essential workers that are currently available or eligible for vaccination. So if there was a community that had a lower age structure, but a lot more essential workers, that would look different than a community where there are a lot of older adults, but fewer workers.
Okay, thank you.
Yeah. Okay. So just to talk through some of the vaccine things, because I know that is certainly on everyone's mind. there are a lot of vaccines that have been administered. I mentioned that, we've done over 6,000. Lakeland has done about 7,000. There have also been a lot of vaccines. I don't have exact numbers, but we have had both Walgreens and CVS under a federal contract have been providing vaccinations to our long-term care facilities. Right now, they've only been doing skilled nursing facilities. And there was one skilled nursing facility that didn't get matched under that contract, and so we vaccinated them. So that's also part of those numbers that are have happened outside of Spectrum Health Lakeland and the health department. And as Ray mentioned, the Benton Harbor Meijer is part of a pilot project in the state of Michigan to start doing some rollout. So there are Meijers in 4 counties that are receiving vaccine off the top of the federal allocation to the state. So before the state starts allocating to the jurisdictions. So by being part of this pilot program, it is somewhat advantageous for our county because it does mean there are additional vaccines coming into our community. We've been trying to work and understand exactly who is eligible to receive their vaccine at Meijer and how that program's working. And there's always some kinks in how things get communicated through a big organization and then to the public. So we're working through that and have some contacts within Meijer as well. You will continue to see as providers come online, there's a whole registration process. Anybody who's going to be a provider, they have to be registered within a system and have an application that the CDC approves. So there's this whole thing. We're seeing a lot in the news as different providers get their applications approved. They are then opening up wait lists, doing press releases saying, we're going to get the vaccine. We're going to see lots of that moving forward. Right now, there are tons of providers. I think there's well over, there's a few thousand in the state of Michigan already, I think, that are these providers. But being a provider doesn't mean you're getting vaccine just yet. And the state right now, I think, is trying to help saturate the healthcare systems and the local health departments who are receiving vaccine. All of us are sitting here saying we can vaccinate more people, get us more vaccine. So we're trying to saturate our ability to get vaccine out before we're bringing more providers on. More providers vaccinating or in the absence of more vaccine just means everybody has less. So there's that balance that the state is definitely working through. I shared with you our 3 goals to protect the healthcare system, reduce morbidity and mortality, maintain certain essential infrastructure. We are definitely aligned with Spectrum Health Lakeland on those goals, and we're working through these priority areas in as close to lockstep as possible, being 2 different organizations, but we're definitely committed to trying to move through that together. Recognize that we want this to be as seamless as possible to the general public, because ultimately most people don't really care what's going on behind the scenes. They want to make sure they have a smooth experience and know where to go to get their vaccine. So that partnership with Lakeland is continuing to go well and deepen. And we're also very connected with lots of things that are happening in West Michigan from here to Kent County and even north, as we've got connections to healthcare systems, the Spectrum Health System, the entire catchment area. So that has been really good to be part of some much bigger regional collaboratives to try to have some uniformity to the extent possible across our communities. Another thing that's really important in our strategy, and this is getting to some of the questions that I know Joe and Linda have already mentioned, is we're trying to have a really balanced portfolio of the types of vaccination events we're doing, how you access those, and then what our outreach strategies and communication looks like. So the state has really encouraged, and from day one, they were saying you need to have an online registration system, you need to have links up to be able to have people just sign up for appointments online, which is great and does work for some people, and it does help automate some of our systems if we don't have to have somebody sitting there taking appointments. But to the points you all made, that doesn't work for everybody, and it's a very significant number and important part of the people eligible for vaccination right now. That process just doesn't work through. We do have our wait list that is filling out a form online. It's a relatively simple process, but it still has had some of its own hurdles. And there are thousands of people on that wait list that did not provide an email address and have indicated that they need phone calls they need a phone call to be able to communicate. So we've been working through standing up, using volunteers to make some outbound calls when staff have an ability to make outbound calls to actually make some of those appointments, trying to get some of those appointments filled before we send out email links to sign up so that phone people have a chance of competing with the email people. So we're doing some of that. But we also know that there are people out there that inherently don't trust government or healthcare, but might still be systems, but also or still want to be able to get the vaccine and aren't sure how to be in contact, or maybe their lack of relationship with a healthcare system previously, lack of access, is making them not know where to go. So we're also relying very heavily on many community partners, both organizations, but also people that have influence in communities that have been disproportionately hit with COVID. And we're looking at 49022 and 49120, the Benton Harbor and Niles zip codes specifically, but not exclusively. But we are looking at heavily in those areas to have community members help carry some of these messages forward, but also influence where we're administering vaccine to try to overcome some of those issues, and also be a connection to get people registered for appointments. So we're trying to have, maybe a 70% approach can go through a mainstream, more automated process that many people, the majority may have access to, but we have a significant amount of effort going into the other portion for whom that doesn't work. Makes things a little bit harder on us, but we're here to serve the community. So we're going to do the harder thing to make sure people get the access that they need. Also in that balanced portfolio, and as you saw in that graph where there were some pretty significant ups and downs of number of vaccines given on any given day, a lot of this too is trying to just settle into a marathon pace with our staff. We're going to be doing this for months and months and months. I mean, it could be August and we're still giving vaccines. Maybe not at the same pace, and the provider mix is going to continue to evolve as more providers do come online and start doing that. But with our staff, we can't, even if we had the vaccine, we couldn't do 1,500 doses of vaccine every single day because of what it does to our team. So we're working to settle into that pace that is we can actually do for the next 20 miles. We were off to a strong start, but we have to keep going. We have to see this through, and managing those human resources are incredibly important. A lot of that is coming, we're trying to build our volunteer capacity as well. And yesterday was actually the first day we had integrated 8 volunteers into our clinic workflow. From what I've heard, the volunteers seem to have a very positive response, and I think we're learning their tasks. We've got many more volunteers that have said, yes, I'd like to, and they weren't able to sign up for our first shifts. So we're working through growing that so that we can have volunteers working alongside our staff to really build our capacity as we're settling into this, endurance pace for the next 20 miles or so. I'm going to pause there. Dr. J, it looked like you had something that you were going to say. Did I see that you had a hand, or do you have to add right now? And then maybe Courtney.
I didn't have a hand up, but that was an excellent summary. And there are many providers, and there are actually many, many more providers that want to do the vaccine, but there are something like 40% of physicians currently are in hospital-owned practices. So in a way, the hospital is speaking for them and will ultimately distribute it to them. So it is about 2,500 providers out there that are interested, and they're pretty much the ones that are actually applying, that are actually separate from hospital systems. So there are tons of physicians' offices that really want to get involved. And just to speak to the Myers phenomenon a little bit, which is happening, I've talked to somebody in another county also. It's very hard to figure out how in the world they're doing it, because they're definitely doing a significant number of younger people that at this moment probably wouldn't fit our category. So it is a little difficult to find out exactly what they're doing right now. And by the way, for those who don't know, they did theirs indoors, where you had to get out of your car, walk in and walk through, as opposed to ours, which are, pretty convenient for elderly people to just drive through.
Yeah. Saw your hand up. Did you have a comment?
Yes, I do. I've actually two things, Nikki. I want to, first of all, just tremendous compliments on what you've been doing. The response that I've had from patients, and friends have been great. Just a couple of points. Number one, you mentioned the inevitable fatigue of your staff in doing this project. And I would just say that I think there are physicians and nurses that are eager to assist. And I think if we can develop a volunteer program, we will be happy to partner with you in helping you get numbers. I think Rick's points are very germane about some limitations in those specific clinics. But the second thing is, with every clinic that I have, I've been asking patients whether they've gotten their vaccine. And I think I'm spending as much time counseling people on how to sign up for the vaccine as I am doing orthopedics. And that's good. But I think your comments today about the widening access of the vaccine, while it's good to have greater access, will lead to greater confusion. And what I would love to see is something on the website that does two things. Number one, is updated so that we can maybe download it and give it to our patients that says, here's how you sign up this week. Secondly, I've had a unfortunately, large number of patients that are reluctant to get the vaccine because of tremendous misinformation about the vaccine and misconceptions. And I know that, that's a quick bullet point document that we could download for our patients as well to give them. All of our practices are seeing so many patients, and I think we could be a nice resource of information. And we understand that there's, a large waiting list, but I think Joe's Florida experience is what we don't want to have. We want to have clear communications, and we want to partner with our physician practices to help us. And maybe you could bring this to your combined meetings with Spectrum Health Lakeland as well. I've talked to Lauren about this also. Thanks.
I definitely appreciate those comments and at least glad to hear that you recognize that it's great to have that broadening access of the vaccine, but it does contribute to just confusion about who's doing what where. We are committed to trying to understand and make connections with all of those other providers. So I've been on the phones with some Walgreens and some Myers and trying to really understand and make those connections. But at the end of the day, we're trying to get us driving all in the same direction.
Bob, I've seen your hand up a couple times. Sorry. Do you have a question or comment?
All right. Just two real quick questions for Nikki. One, status with the discussions with school districts about teachers, because they are influencers in the communities, will help, as they talk to the kids about getting their vaccine. The kids might go talk to their parents about the need to do that. And then second, what we're doing with the senior centers is all at once now I've had friends say, oh, I signed up through the senior center. So I just was curious about, are we doing the vaccines at the seniors, or is it Lakeland, or who?
Yeah, so I'll take schools and then Courtney can answer the senior center question. With the schools, we've been working with school leadership and with the Berrien RESA superintendent, Eric Hopstock, in really solidifying plans that have been a little bit more vague. So all of this is definitely dependent on vaccine allocation, but we now have 3 closed pods is what they're called, points of distribution pod, that's the emergency planning terms, that are scheduled all in the month of February for first doses that should cover all school staff that are eligible and wish to be vaccinated. So we've done lots of coordination with schools. I do believe that many of the schools will be having half days of school on the day of their assigned vaccine clinic to assure that all staff are able to get to the clinics. Because unfortunately we can't, based on planning and other things, we can't have it all happen all on Saturday for everybody. And we've had to space that out over the course of about 3 weeks based on what we understand about how the allocations will be coming through. So by March, we should have almost a very significant proportion of educators and school staff that wish to be vaccinated will have their first dose. Those after that will be eligible to be able to kind of work in as essential workers to some of our other clinics. But we're working through that right now. It's been definitely an organizational feat, but the schools and Barry and Risa have been a tremendous help in organizing all the tiny moving pieces for that. Courtney, you want to talk about senior centers?
Yeah, so the senior centers kind of go back to that balanced portfolio that Nikki was talking about, and some of our discussion with needing to balance who is able to access a computer, and not just access a computer, but readily checks email and can do that quickly and daily or hourly sometimes. I mean, I'm sure you've all heard stories across the state and the country of links go up on a website and within minutes they're full. So I mean, that's also a time thing to be able to just sit and wait. So part of our balanced portfolio is we are having these larger clinics at our office where we're able to do the 1,000 up to 1,300 depending on those hours. And we are intentionally trying to fill some of those and give time for phone calls first. But again, that's not a setting everyone can access or is comfortable. So we're trying to work with a number of partners. One big subset of that is our senior centers. So yes, we are going to a number of our senior centers. We have a couple more still yet to schedule, and we'll probably continue to do that. Our senior centers are great because they know the population in their area. They know who's close. It also makes for a quick drive. And then that is a source that we're not using online scheduling for. The senior centers are actually communicating that out to the individuals they serve, who they interact with. They're able to be that trusted source talking about the vaccine. They actually, we give them a kind of a template schedule and say, here's how many people we can do in that day based on how many nurses and staff we can bring. They fill that schedule and help do reminders. We show up. The senior centers, we're actually at our first one today. They've actually been providing a few volunteers, so it takes a few less of our staff offsite to do that. But then we're able to do that there. And every time we're setting up at the senior center, we're in a cadence where we have booked the first dose, and we also have an appointment already at that same senior center to go back for the second dose. So when someone comes for that first dose, they're told 28 days later, we're doing Moderna right now. So 28 days later, you're going to come back to the same location at the same time. And those senior centers are helping us do those reminder calls. So it's been a really great partnership. They were incredibly eager to help and have wait lists passed. So we will probably go back to all of the senior centers and keep doing this. In addition to senior centers, part of that portfolio is just figuring out what other small community partners in some of our areas that are going to struggle more with that computer access or transportation access, that we can do some of these smaller pop-up clinics. And we're trying to intersperse those with all of our large clinics. So, I mean, I think on our staffing end, that adds a little bit to the work that we need to do, but it again, it's the right thing to do for our community. And it ensures that everyone doesn't have to sit by a computer all day and wait for a link to be on a website. And hopefully they're lucky enough to get that appointment. So we're really trying to balance that so it doesn't have this frenzied feel of how and where can I get my vaccine, to the extent that we can help with that.
Joe had a couple questions. Do you want to raise those?
Yeah, that's fine. I just posted them. I don't want to keep butting in, but I was wondering about the severity of second shot reactions. I've heard there's a much more significant reaction. And the other, which would be a good thing to know, is what percentage of the hospital staff got vaccinated? I mean, they're the most in the know, you might say, and I'm wondering if they've gotten very high, or what the odds are. I've read where some hospital staff and nursing home staff are not getting maybe only like a third are not getting vaccinated.
I'd be glad to try to tackle those. So in terms of the second dose, it was from the phase 3 trials, it was about 3 to 4 times as many people with both Moderna and Pfizer were likely to have some of the more significant reactions of fever, malaise, and bad achiness, and a really, really sore arm. So that's why Lakeland and others staggered some of their doses and have staggered some of their second doses. So the numbers appear to come out about true like that. And I was speaking with the Oakland County Health Department medical director a week ago, and he had recommended staggering a little bit to some of his places, but then he in his own health department said we didn't stagger second doses for our entire health department. And virtually everybody in their health department, it's a large health department, got vaccinated. And the next day, 12% of their workforce did not come to work. So
Yeah.
he said that's probably about what it was. And most of them, of the ones who didn't come to work, either had a fever or were seriously achy and ill. So those are the people that come. So it is a real phenomenon. Although it's a short phenomenon, most people that are feeling miserable, it's a 4 to 8 hour fever, achiness, or whatever, and then it's over. So then they're coming back. So I hope that answers that question. What was the other question about that?
Well, I just was curious, the percentage at the
Oh, right, okay.
hospital.
Right. I'm not sure if Nikki might know Lakeland's numbers. I heard it was edging toward 50%. And that's sort of what it's been nationwide, is 50 to 60% of healthcare workers are getting it. It's hard to tease that out because sometimes it's, what percentage is your custodial staff, what percentage is your nurses, aides, et cetera. But I think that's the number I've seen in most publications and from a couple of hospital systems here in Michigan. And I think Lakeland Spectrum was in the 50s. Is that right, Nick?
Right. I haven't been able to get hear the exact number, but it is somewhere in the ballpark of 50 to 60%. But to Dr. Johansson's point, there are a lot of roles within a healthcare system that don't necessarily have direct patient contact. So who you use as that denominator does matter too. One of the things, though, that you said, Joe, that is important and something we're continuing to watch, it does seem like there's maybe a little bit lower of a percentage of staff uptake at nursing homes. And that's something we really want to monitor. That's something that, even though long-term care facility staff are part of this federal contract, the health department is ready and willing to vaccinate any of those staff members at any time. So if they choose to be vaccinated after there's already been a visit from that pharmacy on site, they are very welcome, and we want to vaccinate them. So we're trying to be there for that the moment somebody changes their mind. But because we know that having staff in those congregate living facilities who are vaccinated is incredibly important for the residents as well.
My aunt is 94 years old and she lives in a senior apartment building, and I'm not sure who did it, but someone had a shot clinic down there last week. And I don't think that people had to sign up. They just showed up and they got their immunization. So that was pretty cool. And I was just wondering also, the emergency rooms. I think the people that come there usually are pretty, they're sicker individuals, and it might be a good idea to have the emergency rooms offer that as well.
I know Spectrum Health Lakeland is working on how to integrate the vaccine into operations. It is definitely not sustainable for them. I don't know if it's really sustainable for anybody, but to be doing these really large scale clinics. So I know that they are working on what those workflows and procedures would be. And I think that might be something that would be on the horizon.
Great.
Ray, did you have a comment?
Yes, I did, Greg. For Dr. Johansson, what's the recommendation and issue with an analgesic before or shortly after the receiving the vaccine?
So I don't think that anybody's saying you should or could or whatever. With the first dose, the number of people that have reactions is so small that personally, especially considering now some of the warnings with ibuprofen, for instance, I wouldn't recommend that for people to take it. I would just wait if you have a reaction, and then you could do Tylenol or ibuprofen afterwards. But I don't think it's part of any specific plan recommended by large groups. We're not making any recommendation in that regard.
Okay, thanks.
Sure.
So go ahead, Dwayne, and then Ken.
Look, this may be too far in the future, but I recognize that this is, we've never in our history done mass population vaccinations. I mean, do you envision as weather warms, are we going to go out to the community, to employing organizations? Do you see us having the capacity for them to always come to us? How do you see, April and May coming with these vaccinations?
These are really great questions. And Courtney, please chime in. I mean, we've definitely talked about how our strategy, when the weather warms up just a little bit, come March, April, doing more drive-throughs, but in much larger venues. I mean, that's when we could potentially utilize the fairgrounds, and I mean, we could have a lot of throughput in those situations. So I do believe that it'll shift and we'll be able to be perhaps a bit more agile. I also think we're going to be through some of the early adopters, and right now is a unique time where demand is far outstripping supply. As time wears on, demand's going to go down and supply is going to go up, and we're going to have to work to actually build demand at the same time that we're administering vaccine. We're working to try to address hesitancy and all of those things right now anyways, but this is a short-lived season where we have such high demand and so little supply. So we're thinking through what a lot of that looks like, thinking about different venues. We don't have a DeVos Place type venue here in Berrien County. Also, as hopefully as our transmission continues to go down, as our levels of herd immunity continue to increase, it will become a little bit easier, but we're doing a lot of things right now to avoid large groups of people congregating amongst one another. Honestly, we've come to realize through studying our operations, the biggest limiting factor in how many people we can vaccinate in our office is not our office space, it's actually our number of parking spaces. So that's been interesting for us to learn, and is informing how we're thinking about venues moving forward and the overall strategy. But we will definitely be digging far deeper into the corners of the community as time wears on.
Thank you.
Something?
Yeah, just two points. Number one, to sort of echo what Rick said, very few people have had significant reactions to the second dose. So I think it's important at this meeting that those of us that have experienced the vaccine personally and have seen many, many patients that have had it and many, many providers that have had it, the results of the second dose are not what people should be concerned about. But I'm interested in, Nikki, your comments about this ongoing lack of understanding of the vaccine. I think when we talk about the health department with Lakeland's vaccine adherence of about 50%, that's very concerning. And I, there's a very well publicized article in the paper in the last couple of weeks that I think added to the misinformation. And I'm just wondering, what are we doing? Because this is going to be very important when we talk about health equity and we talk about getting vaccine to the population that really needs it. These confusing messages are very troubling. And I'm just wondering what we're doing specifically in the realm of education for our community.
Julian, do you want to give the first go at that?
Sure, and absolutely, Dr. Edwards, we know that while we are balancing, like Nikki said, the overwhelming demand on one side and communicating to the people who are very eager to receive the vaccine, we also have another subset of individuals who may still have questions that are unanswered and feel hesitant and are not sure of what information is true or credible. That is where we are committed to providing that factual, credible, science-backed information and really have candid, transparent conversations with people that allow them to, make that decision for themselves, what's going to be right for themselves. A lot of that work happens at a slower pace than your mass media is capable of doing, and it happens through relationships. We are working closely with Spectrum Health Lakeland's population health division and working through a lot of the influencers that we have in Benton Harbor as well as in Niles. Those two areas are kind of primary foci at this point. And we are engaging leaders from faith leaders to just community leaders to people who are the movers and the shakers and have a sphere of influence that once they have information can help disseminate that and empower others to learn what they've learned. So that's a lot of our strategy right now. We are also exploring lower tech options for communicating. We know that not everybody's on Facebook and not everybody's looking at our website, and that's okay. So getting things regularly in papers and on the radio, even going a very old-fashioned route of having handouts and flyers and ways of getting those out, including using our schools as a great way to disseminate information out to families. So there are a lot of things that are on in the works and plans that we have been developing. There's always more that we could do with education. And as Nikki mentioned, with just a bandwidth capacity, this is one area that we know we could always be doing more. Our partnership with Lakeland and with other community partners as well, I think is something that we're leaning really strongly into, as we know that our staff are still somewhat limited as far as the hours we're able to contribute to that. So I think there are a lot of good and exciting things that are in the works, and I'm looking forward to continuing this educational campaign for many, many months, because it's not going to be a one-time message. This is something that will be an ongoing sort of steady drumbeat of information that we will be putting out into our community.
Before we started the recording this morning, there were a number of comments that were praising the health department's efforts. So it just has been a joy to receive those texts and emails just talking about the excellence and the efficiency. So I want to certainly say, well done, very well done. So yes, everything could be more, but it's amazing what you've done so far. Thank you so much.
Thank you.
Yeah. If there are no more questions on vaccines and COVID, I'd like to move on to a very sad discussion.
Yes, so I regret to inform you that I have accepted Lisa's resignation effective towards the end of March. So our days are numbered with Lisa as our business manager. And while we're very happy for new things she has on the horizon, and as she's moving into another chapter of her career, we will definitely miss Lisa as well as her expertise and what she's done. So just wanted to make you all aware that that transition is coming. We do have the position posted now and are starting to accept applications for that. So please feel free to disseminate that throughout your networks. We're working to do some targeted recruiting of applicants as well, but some big shoes to fill.
Oh. Thank you for your excellence, Lisa. You've brought us to a new level. We're most appreciative, but at the same time, just incredibly sad to lose you. So, yeah.
You have me for a little bit longer, so I'm not quite out the door, but it's been, I appreciate and have really enjoyed this experience, but I've got, you'll see me the next meeting.
Yep. Yeah, we do appreciate having that longer transition period, especially in a position like this. That's kind of one deep, so.
As we build our salary schedule, and this comment is for you, Bob, and how the county works on, how we pay competitively, I would ask that there be an exit interview of Lisa leaving, and that information, well, Shelley do it or whomever does it, so that we gather that information. So.
Yeah.
Good.
All right. So moving on to Ms. Keena. You want to give an introduction to what the family health programs, and then Ms. Keena can get on video and sound.
Yep, so Keena King is our family programs manager. There have been a lot of things happening in how we deliver family programs over the last year, as you can imagine, with certain things needing to be paused and other things needing to be rethought through. And Kina has been in the manager position that was newly created in July. So she's been in that position since then. So we wanted to make sure you all had an update and had an idea of how we were approaching things. So Kina, are you ready?
Yes, I am, and I'm so sorry. I am having issues this morning with my camera, so I'm here and I can see you all, but I am so sorry that you guys cannot see me this morning.
That is okay.
So my name is Kina King, the Family Health Programs Manager here at the Barron County Health Department, and I want to just share with you guys just a brief overview of some of the things that has been happening with our family health programs. So the Barron County Health Department, we have continued to serve our families through our home visiting programs. Although some of the services have been slow going because some of the things that has been happening around COVID-19 with many of the restrictions, we have continued to engage with our families and our community partners and run interference as much as possible. I think Barron is uniquely positioned as we have been able to offer multiple programs that fit the varied needs of our community, and this is allowing our teens and supportive adults to have more of the option to see what programs would best fit the needs that they have, and not so much of us guiding those choices, but just supporting them and giving them the option to choose from our programs. Although we serve our most vulnerable population, we still rely on some of our community partners and support from our health educator, case managers, and our nurses from Nurse Family Partnership. Some of the programs that we have been rolling out is the MAIA program, Michigan Adolescents Pregnancy and Parenting Program. And this program works with our pregnant and parenting teen population. And the aim of this program is to reduce the number of repeat pregnancies. And that program is currently staffed by one case manager. We have currently at this time, Mr. Charlie Patterson, and he has been doing a phenomenal job working with our families and our community partners and just being consistent and keeping our families engaged, especially during this time with COVID. Even though we have had a lot of things that we have had to hold back on, we still saw 5 graduates from Benton Harbor High School, and we have 2 graduates that's on track to graduate in 2021. And I think that is phenomenal for our teens to still be able to obtain high school graduation during a pandemic. And so we continue to support that work and support our teens. We also have one young lady that's enrolled at Lake Michigan College, and we will have our first college graduate in May from the MIAP program. And we're really excited about that. And so again, continuing to provide those supports and those additional undergirdings that have been needed for the families. The Nurse Family Partnership Program, that program serves our first-time moms during pregnancy and up into baby is 2. And that program is fully staffed. We have 4 nurses currently with that program. And we have Jackie, who is our coordinator for Nurse Family Partnership. And that, we have 4 nurses and 1 coordinator. That team is full capacity with staffing. We have had to pull 2 of the nurses who have supported some of the work with contact tracing and case investigation. That team has been really vital in supporting the COVID-19 work that has happened with our clinics, and we continue to work to support all our staff. We have the Taking Pride in Prevention program. So I'm going to give you kind of just like a brief synopsis of what's happening with our home visiting programs. And so with our Taking Pride in Prevention program, that's an adolescence program that works with our youth aged 12 to 19 to educate on abstinence and contraception through the implementation of our evidence-based program called Making Proud Choices. That's the curriculum that we use to implement that program. And the rollout of that program had to pivot a little bit because of COVID, of course, and we was initially partnering with the Benton Harbor Boys and Girls Club, and also some of the schools within the Benton Harbor School District to really roll that program out. And when COVID hit, we had to change the way the delivery of the program would happen. And so we have been able to offer virtual options for the program to happen. We had one cohort that happened. We had 20 participants to attend the cohort, and that went really well. Part of our Taking Pride in Prevention program, our health educator, Latoya Turner, does an excellent job with connecting with our teens, and she provides that additional support that is needed. Our Taking Pride in Prevention also had a workshop to engage our parents. The workshop was an hour-long workshop, and it was talking about how do you connect with teens during COVID. And so it just really helped the parents to have that conversation back and forth with their teens about what's happening during COVID, and just giving them the opportunity to really share what's going on. And we had 15 parents that attended that, and that was very, very important because some of the parents were struggling to connect with the teens during this time.
Great. Sounds like you've been creative, and so thrilled to have the college graduate. Oh my goodness.
So we all
That's wonderful.
So we
Yeah.
also have, I'm sorry, I have a little more if I have a little more time.
All right.
Okay, so we have our Triple P Positive Parenting Program, which is an early intervention program that have been able to support our families. And our Triple P program has had 1,289 contacts with parents across Barron County. 324 parenting classes have happened, and those classes consist of 8 sessions. We have 14 resource coordinations and 343 interventions. And I think that was huge to continue to provide that type of services for our families. And that was from January to December. We also have our Son to Father program that works to educate and supports dads in their knowledge and skills and attitudes regarding parents. And this program is uniquely designed for dads. And so it has its own special purpose. And we had one cohort with 7 dads that completed a 12-week program. And some of the things that was covered was knowing your parenting style, the cost of having a family, the problem-solving toolbox, and that was facilitated by our case manager, Charlie Patterson. And some of the partnerships that the Barron County Health Department has been able to garner has been huge in working with our families. We currently have a small grant with the ABREST project, Achieving Birth Equity Through System Transformation. That work is going to guide some of the work that's happening around our Raising Up Healthy Babies Task Force. And as you guys all might know as well, the Barron County Health Department will also be spearheading the LLG, another acronym, Local Leadership Group, and that's designed to enhance and bring families together with a home visiting system. And so I know that was kind of like a lot of information, but I want to say that it has been vital for us to continue these services to provide for our families during this COVID-19. A lot of the families we serve, we see that so many of the families have they're experiencing a pandemic on top of a pandemic. And so we have really been intentional and consistent about supporting and engaging our families and providing those services and trying to meet the needs as best as we can. And like I shared with some of the graduations that we've seen, we have still seen so many of our families to be able to strive during this time. And I think that really goes to the hard work that the nurses have done with the families. Also, our health educator, our case managers really take pride in the work that happens and the way in which this work is carried out. And so I'm just happy to be a part of that and support our community, because I think everyone have been kind of like taxed with everything that's happening around COVID-19, and now we're in mass vaccination is happening, and we have been having to pivot and pull some staff into different directions. And so we still have been able to support our staff as this process has been rolling out.
Wonderful.
So,
Courtney, do you have a
do
comment?
anyone have any questions? I know that was a lot of information. Courtney, is there something that I did not share?
No, I just wanted to say before questions. So Kina, you did a great job. And I just wanted to bring between the lines what I think a lot of people heard, but our family programs team have been pulled in a ton of different directions. This is not unique to this team alone. Every team in this department has done that. But I've just been so proud to watch how well they've spent a whole day out in the parking lot helping do clinic things. And the next day they are here checking in on families and doing classes. And then the next day back helping with clinic. And so everyone has just been pushed and pulled, and they still have this like burning desire and passion to ensure that our families are being served throughout all of this. And I just think that is such a testament to this team. And Kina, it was a great overview. I just want to make sure that between the lines of the work that you all have done to really engage with families and prioritize that while still saying, yep, we can help with that too. Really, that's a great thing for this team to say thank you for.
That's wonderful.
Thank you guys for allowing me this opportunity. I know that seemed like a lot of information, and I wanted to try to make sure that I shared some of the high points that has happened during COVID, because there's a lot of other things that's happening beside COVID as far as us rolling out our programs and continuing to support our families through our home visiting programs, whether that's MyApp, Michigan Adolescents Pregnancy and Parenting Program, whether that's Triple P Positive Parenting Program, or TPIP, or our Son to Father program. We have a lot of programs, and the unique thing about the programs that we have, it allows our families the option to choose what program will best support them. And so during this time, unprecedented time that we're in, I am, really happy to be able to continue to, again, provide services and support to our families, because we have really seen that there has been a huge need in the support of services that we've been able to provide. And also we have seen that a lot of our families have been able to lean into some of the strategies and the skill sets that the nurses have worked with them and have helped supported them. And so that is even great to see during this time. Sometimes you work with families and you wonder, like, wow, am I going to see the fruits of my labor, right now? And so just seeing some of the families to lean into some of the work that is happening, I think has been wonderful in this time. And right now, just being transparent, I will take those great moments and really cherish those, because that is why I'm in public health, and that's why I do what I do. So.
Thank you so much. I really appreciate it. So I wish we could meet some of those graduates. Yeah, that's really neat. All right. If
I may, this is Jillian, just to make one more compliment to Kina and her team. Kina, who has done a variety of different trainings around the community resilience model, has also contributed to our COVID response in a significant way by doing a series of videos that we call Moments of Mindfulness. Yeah. You can catch these out on our social media channels, but Kina has been just a really calming, grounding voice and presence on those social media channels as she kind of almost leads the viewer through just that moment of mindfulness, a little meditation exercise, kind of reminding people who are watching, what else is true? How can we make sure that we stay grounded as there's so much going on around us and stress levels are high? So I am so thankful for Kina in the fact that she's not only leading a team who are helping families, but also leading, all of the people who are watching on our social media channels and providing those moments of mindfulness.
Thanks for the reminder, Jillian. I've enjoyed them as well. So good. All right, moving on in the agenda, Bob, what's the good word from the Berrien County Board of Commissioners in general, what's happening and what's happening that impacts the Board of Health or we should be aware of?
Well, we're in the reorganization rollout now where the commissioners all got new assignments from Commissioner Elliott, the chair of the board. He continues to be the chairman, and Ezra Scott from New Buffalo is vice chair. And then I'm serving as head of personnel, and then Jim Curran is continuing as chairman of administration, and Mamie Yarborough as chairman of finance. So not a lot of changes. We're got a number of issues. One that's on the discussion phase is just starting is the salary survey that you referenced earlier. We'll be taking a look at that. We're still working with the new administrator, Brian Doucette. I think he's doing a great job, but there are a number of balls in the air. And I think as Nikki can attest to, after you get one, you catch one, and then four more hit you in the head. And so we're all trying just to keep our heads above water. I think all of the board members have either had their first COVID shot or have a family member or a neighbor who's gone through the process operated by the health department. So a lot of really good positive feedback. One of the commissioners said this is the best PR program for the county that's ever come about. So that's I guess that's good. I'm not really sure, but it is well reflected on the county and the health department. And so that's pretty much all I've got to report at this point in time. But we do appreciate everything that Nikki and her staff have been able to do. And it's a tough challenge, and I think you're doing quite well with it.
Great. So sorry, Vanessa, did I cut you off and comment for Ms. Kina? No? Okay. All right. Sorry about that. You're on mute, Vanessa. Okay. So sorry, I'm trying to keep an eye on everyone, but I'm messing up at times. So my apologies.
Peg, I just want to say I'm going to jump off now. I just want to thank everyone for allowing me this opportunity. And I want to thank Courtney for the great support that she has rendered to our programs and just the work that everyone, our team has done, Lisa, Jillian, and just everyone, Dr. J, Nikki. I just have to say this has been very challenging work, tiring work, and I just want to say to this team that I appreciate what's happening. I appreciate the support that they have shown, and thank you guys, and have a wonderful rest of your day.
Thanks, Kina.
Very much.
Yeah.
All right. We're down to the point in the agenda where the Board of Health there's time for a discussion. I would note that there is a sewage appeal. As you saw in the budget, that presentation that Lisa gave, that sewage permits and things are way up, and so are the little quirks of the appeals as well. So that is continuing. So is there anything of general discussion before we end the meeting? Yes, Dr. J.
So I'd be remiss in not mentioning that yesterday I found out that we've had wonderful directors of nursing through the years. And we had one that was one of the first people I met at the health department in 1977. She was hired in 1970. It was Joan Eberly. She had been a nurse, then took time out to raise 4 children and came back, got a master's in public health at University of Michigan, and then started working with us in 1970 and was director of nursing through 1990 and did a lot of terrific community work. And then she retired and moved away. Well, she died 2 days ago from actually COVID-related stuff at the age of 93 in North Carolina. And she was a terrific community person, did a great job. Mike Mortimer knew her well from back then too. And be remiss in not mentioning, she was a really positive influence at the health department and the community. So, you know, Blessings to her family.
All right. Anything else before we adjourn? Well, thank you all for joining us, for your astute comments and questions. We appreciate your participation on the Board of Health and the staff. Nikki?
Real quick, just Jillian, have we been getting any public comments from YouTube?
There are no public comments on YouTube.
Thank you. I forgot that. So,
Okay.
all right.